Hi, this is Dr. Nikole Ostrov, board-certified gynecologist from Maiden Medical, Midtown, Manhattan, here today to talk about birth control options. Probably one of the more common questions in counseling we do as gynecologists in our office is discussing birth control options with our young reproductive age women, and I think there's a lot of questions out there as to what the options truly are. So here goes. I think in general, when I'm asking a patient, are you currently using birth control? And most automatically think that means a pill. Birth control pills certainly are still the most common form used birth control in this country, and for good reason. They're still wonderful forms of birth control, but there's other options out there as well. I think one of the more important things in general when first discussing birth control options with my patients and when you are discussing it with your practitioner, it's important to discuss your entire medical history as to why are you going to be starting the birth control. Is it just for contraception, or are you going to be using it for some of the non-contraceptive benefits, for acne, for painful periods, diagnoses such as endometriosis, premenstrual symptoms? So options out there, we kind of tailor based on the needs of the patient and the patient's history. So a good history is really important. I break down birth control options into patient-administered options that you can give to yourself versus those that we as physicians or providers can help you with by placing it in the office for you or giving it to you in the office. So the patient options, there's non-hormonal patient options. First, there's barrier methods, which we all know of as condoms. There's also some other options that are non-hormonal. Certainly not the most effective form of birth control, but some patients will use what we call the withdrawal method, where the male will withdraw before he ejaculates into the vagina. There's also the timing method, or what some women call the rhythm method, where you're going by your menstrual calendar, trying to figure out when you may be the most fertile based on your menstrual cycle. Now, the timing method, the withdrawal method, and even barrier methods, they're not the most reliable, they're not the most effective forms of contraception because of user error. And therefore, we kind of encourage our patients, if this is their sole method of birth control, withdrawal and timing more specifically, maybe to consider other options, or just know that there's a much higher percentage of women that do get pregnant using these options. And so again, our job is to counsel patients and to give you other options that may be better options for you. The hormonal contraceptives, I break it down again into patient-administered versus those that have to be given to you in the office. So patient-administered options would be the pill, the ring, the vaginal ring, or the patch. So the pill, most women have heard of before. It is one that you do have to be good at taking around the same time every single day. So if you travel a lot, if you're more forgetful, don't think that you'd be good at taking something every day, or just don't want to have to be having to take something every day, it may not be the best option for you. But the pill, it will give you usually timed 28-day bleeds depending on the pill. It's something that is taken every single day. You get a new pack every single month, and you have to be good at taking it. The ring, same types of hormones as the pill, which is estrogen and progesterone for the most part. Pills are made up of estrogen and progesterone, NuvaRing, estrogen and progesterone, patch, estrogen and progesterone. The ring is just given in a different manner. So instead of having to take something every day, it's a pliable vaginal ring that you place up inside the vagina. It can't get lost. It can't go anywhere. And it stays in there for 3 weeks, after which you take it out, and that's the week you get your period. So 3 weeks in, 1 week out, period. The patch, again, similar hormones to the vaginal ring and the pill, except it's something placed weekly. So it looks like a little sticker. It's placed, usually my patients place it on areas that will be concealed with bathing suits, underwear, etc. And so most will put it on the front of their pelvis or kind of behind on the buttocks area. You can place it on your arm if you want to. And it's changed once a week. After 3 changes, you're going to have a week without the patch, and again, that's the week that you get your period. So 3 weeks on, changing once a week, 1 week off, period. So patient-administered, pill, patch, ring. And those, for the most part, are estrogen and progesterone. They are much more effective than the other methods I first talked about. There can be some user error, however. So with the user error, forgetting to replace the ring, forgetting to change your patch, forgetting to put the patch back on, forgetting pills and having to double up, it certainly makes it less effective in prevention of pregnancy and opens up a larger opportunity for an unintended pregnancy. But then we move to some longer acting forms of reversible contraceptives that are a little higher efficacy in prevention of pregnancy because there's much less user error. So intrauterine devices, IUDs, and the subdermal implants, the rods that go in your arm. These are what we call longer acting forms of reversible contraceptives. They are placed by your practitioner in the office and they can stand for years. The implant in the arm and most of the IUDs have progesterone in them. So unlike most pills, the ring and the patch, which are estrogen and progesterone, these are just progesterone. And they do help with your periods as well. For the most part, your periods will get a little lighter and a little less crampy and a little shorter. Sometimes they go away altogether, which is okay when you're on hormonal contraceptives. And so that's a benefit. They can stand anywhere between 3 to 6 years at this point, depending on which device we're talking about. So it's almost like place it and forget it. You don't have to worry about something every single day. And because the user error is not a factor here, they're over 99% effective in prevention of pregnancy. There is another intrauterine device, or IUD, that is non-hormonal. It's the copper IUD. Here in the United States, it's called Paragard. That's the brand name. That one can stand for up to 10 years. But again, patient history is really important here because if you already have heavy periods, very painful periods, I like to set up the right expectation with my patients that this one can make your periods a little bit worse. It can, not always. And for some women, it's not to a very high degree that it's worse, but it can. So unlike the progesterone IUDs, the hormonal IUDs, where periods usually get better, the copper IUD, they can get a little heavier, a little longer, a little crampier. So again, this is where history is really important. And again, we also talk about the non-contraceptive benefits of hormonal contraceptives. So if you were, wanting to help your acne, well, there may be a pill may be better for you than some of these other forms of contraceptives. And certain types of pills, depending on what the hormones are in that pill, will be better for you. If you have a history of high blood pressure, if you have a family history of certain medical conditions, there may be one that is better than the other. So again, talking to your physician or healthcare practitioner about why you're starting this birth control in the first place and what your goals are with this birth control is really important. The last form of contraceptive that's going to be administered in the office by your physician is actually a shot. It's called the Depo-Provera shot. Depo-Provera is the brand name here in the US, and it's an injection that's given either in your arm or in your buttocks region once every 3 months. Just like the hormonal IUD and the rod that goes in your arm, it is progesterone only, and it's given once every 3 months in the office. So you do have the convenience of not having to take something every day or change it yourself, but you would have to come into the office once every 3 months. With this one, most of the time your periods go away altogether. And so again, if you're using it for contraceptive benefit of helping your periods, you would certainly get that benefit. And then very lastly is permanent sterilization. And these, again, aren't meant to be reversed. So there's male permanent sterilization and then there's female permanent sterilization. These are done with surgical procedures. They are meant for the woman that is completely done with childbearing. And so if you're unsure, then I highly recommend using one of the other options since there's so many others out there that we discussed. So these are basically the options in a nutshell. There's certainly benefits, risks, and side effects to all of them. And so it's really important to discuss everything with your practitioner in the office or over a telemedicine appointment. These are great appointments to do over telemedicine so that we can discuss, your concerns that you have about it, ease any anxiety you might have about starting contraceptives, and really just go through the options and educate you. So make an appointment either online or in the office, and either myself or any one of my colleagues would be very happy to go through all these options with you.